Od thieth ma Pumwani wacho ni chenro makare nitiere mar bero thieth miwacho ni oganda osebedo ka yudo ka thiethno. Od thieth ma Pumwani manochaki higa ma 97 higni 97 mokalo gi duol ma chiwruok mong'ere kaka Lady Rig Welfare League masani nitie bwo sirikand kaunti ma Nairobi osebedo gi ng'ikruok mathoth motenore kod chenro ma gichiwo godo thieth ne jopiny kaka Sharon Ong'ao leronwa.
Jotatije e od thieth mar Pumwani yango ni od thieth mar Pumwani osebedo gi lokruoge mopogore opogore mar neno ni chal mar jotuo ochiw e yo makare.
So for our bed capacity, we have a 354 bed capacity, which has we have tried to reduce that because of the COVID. When COVID came in, we reduced it to 258. Our wards are divided into the postnatal, where we have the ones who are from the theatre, and we also have the ones who have delivered normally. So we have separated the two, and then we also have the cots. So we have around 87 cots which serve the babies in the NBU.
Jakom mar od thieth mar Pumwani wacho ni gisani giyango chenro mopogore opogore magibiro keto e tim mar neno ni jotuo oyudo ratiro margi kinde duto.
And working together as a team is set out various initiatives through which we intend to, one, improve the services that are available in Pumwani, and number two, ensure that the community around us is familiar of what we have to offer in Pumwani, and that we've sensitized them, one, on the capacity of workers we have here. You can see I have a big team, excellent staff, nurses who've worked here for 20 years, 13 years, doctors who've worked here for a really long time, and who are so passionate to ensure we get good health outcomes. Our second initiative is known as Pumwani Mashinani, and this is essentially in light of what His Excellency President Ruto launched, essentially bringing health to the community. And so Pumwani shall follow that cue.
Jotatije e od thieth mar Pumwani yango ni chakre dwe mokwongo nyaka dwe mar 9 mar higani. Pumwani ne orwako mine mapek 15,000 mondo konyre. Kwan mowacho ni en mine maromo 1,600 e dwe ka dwe. E kwan nyithindo mane onyuol, atamalo 70 ne onyuol kokalo e dhod nyodo, kata malo 30 nonyuol e yor pala.
We do around 5,000 to 6,000 deliveries in a quarter, and we have CS deliveries, and we also have spontaneous for the vaginal, and we are able to serve mothers through our Linda Mama initiative, and so far we've managed to have around 500 to 600 newborns being taken to the newborn unit.
Board na wacho ni bende gisebedo ka giyuda chiedh nade makoni kod kocha mar chwalo lokruoge mopogore opogore e od thieth ma Pumwani. Kachiel kuomgi en nok lakteche.
We are supposed to have one mother, 2 midwives, and right now we have one midwife doing 18 mothers. So it is an acute shortage that we need to work on, and also for the theatre and the NBU, we have to have the capacity as one baby to be taken care of a neonatal nurse, of which there is a very acute shortage for the same. So we are having an acute shortage of staffing in the hospital, but our nurses are doing a very good job to ensure that the outcomes of the mothers and the babies are at a high level.
Jakom board ma Pumwani oyangone gisani gichako campaign maidendo ni Pumwani kwa ground. Chenro magichano sero godo medruok mag jotuo mayudo thieth Pumwani.
We are actually introducing a new model that we are calling Pumwani Mashinani. This will not be just a one-off camp. This is something that we'll be doing routinely to ideally ensure that we go to the community.
These 70 years, we have not had a lift in the hospital, which right now we have a working lift in the hospital to assist us in moving the mothers from the labor ward to the postnatal wards, and also move the food from the kitchen to the wards, which has really assisted us. We've also had, we didn't have a generator to service all the wards and the theatre. We have 2 theatres who are running, plus the oxygen. So right now we have a very big capacity, a 500 kVA generator, which we commissioned, and we are grateful for the governor for that.
Board mar od thieth ma Pumwani wacho ni lokruoge magisebedo ka gitimo oseduoko chien kwan buche manise godo, ahinya to mar lal mar nyithindo. Wach ma jakom board no wacho ni pok giyudo bura mora mora mar kuo mar nyithindo chakre higa mokalo. Sharon Ong'ao, Ramogi TV, Nairobi.